Hi, hello, namaskara, and RJ Nikitha, Radio City 91.1 in the. And with us, we have Dr. Saurabh Misra, consultant and head of Gastro-intestinal Robotic and Bariatric Surgeon Apollo Hospitals. It's my immense pleasure to invite you here, Doctor. And I'm sure you're having a very tedious day or probably a power-packed day. How is it for you?
We've been operating since morning.
Yeah,
Hi, Nikita, and good evening, everyone. So it's a pleasure being with you.
superb. And
Uh,
likewise. Yes, Doctor, you were telling something.
yeah, so so we had now the Corona season is over. So I guess a lot of people who had their surgeries deferred, now they're getting it done. So we do have a power pack, not only the day but the week and the year ahead.
Right. So I have this interesting question. I always keep getting that in my mind. So this is all about lifestyle. So do you get time to have that peaceful time for yourself in a week or in a month or a year? Do you make some time for your well-being or something like that generally?
Oh yeah, I think one of the big misconceptions about doctors is that they just work. But the new generation surgeons and doctors do take care of themselves, and they because they know that the work life balance is important.
True.
So what we do is that we try to develop teams who can who are equally trained, and then we do work as a team so that the work pressure becomes less, and then we have more time for ourselves.
Mm-hmm.
Work and we try to balance work. So we have a lot of things going on
Yes.
simultaneously for us. So
Right.
that
Right.
gets us some time for ourselves.
Superb. And that's a noble profession, and also which has got so much to do with many, many lives. So may God bless you and stay blessed. That is what we wish. And with that high note, I have a couple of questions, Doctor, to talk about today. As you said, the Corona season is over. Many of them are still attached to the lifestyle where they are not able to go out. Probably they're sitting before the system and working all day long, but they're not taking time for themselves, and that might have led to many disorders and diseases. Keeping that in mind, generally, obesity or many other disorders when we face. So, we would like to, dive into the exact meaning of obesity, how it comes out. I mean, how one human will get into it and all of that. So, can you let us know what is obesity and why is it important to address obesity as a disease?
Uh, Nikita, what happened was that basically we by the definition of obesity means that is this excess body fat. Now,
Yeah.
because of this excess body fat, um, it has direct consequences of health. That means it also affects and causes other diseases like diabetes, hypertension, and sleep apnea, kidney diseases, and you name it. It's all there.
Mm-hmm.
So what has happened is that during the Corona season, a lot of people have been confined to their homes. There are a lot of being mental issues. A lot of people who did work from home uh, got a lot of food stuff from outside, and which was largely processed food, and that's where so there was stress, there was work pressure, and there was lack of exercise. So all that they cause a lot of excess body weight, and people people just didn't bother at that point of time because they were more keen about getting through the phase.
True.
So as a problem, as a problem, the nationwide problem. So the latest consensus, what happened was, which is the result which have come out in 2023,
Mm-hmm.
the National Family Health Survey number 5. It showed the shocking 57% of Indians, 57.7% of Indians were either overweight or obese,
Oh.
and so that's a huge percentage. And
Yeah.
then you were look, and then there were 13% of people who were actually obese. Means we're talking about people who are above 32.5 BMI.
Mm-hmm.
And the worst part was that the children constituted a fair amount of these population.
Mm-hmm.
So the females were about 24%, males were about 23%, and the rest of them, almost 10%, were kids. So
Mm-hmm.
that's very concerning because these are the generation which are going to come forward.
Yeah.
So, so a lot of things changed in 2014 when the American Heart Association changed the definition of obesity, not from it was considered to be a lifestyle issue, but they categorized it into a disease. Now, when they actually did that, a lot of focus changed. That it was not like smoking or just being sedentary. It was like a disease itself has to be treated as an individual disease. So
Right.
that is where the whole, because a lot of data was available to everyone to say that this has to be given importance in a different sense and not just saying, okay, go and lose weight. So then a lot of industries started to have products, and there was an impetus from the insurance companies to cover these surgeries as well. So a lot of things happened after that.
Yeah.
So that's where the whole focus changed.
Mm. That's true. So, for our general understanding, can I ask you this question? So, when we say that obesity is a disease, so what's the difference between disorder and disease?
Well, disorder actually means that you are there is a combination of small issues which can become a disorder, um,
Mm-hmm.
like disorder, a mental disorder, let's say. So mental disorder is basically uh, a lot of we kind of stigmatize when you talk about disorder. That
Right.
is a disorderly person. But when you talk of disease means that a lot of things are happening which are not in control of the person.
Okay.
So we have to treat a disease on its merits,
Mm-hmm.
and then treat the person that not everything is in his hands. Like typically, the obesity has its origin in genes, the
Mm-hmm.
stress around the person, the
Yeah.
lifestyle issues, and so many other things. So now, Cleveland Clinic recently took out a paper in which they have identified 50 types of problems which can lead to obesity, including sleep, how much sleep you get, and how much what you eat, how much exercise you do. So all this, is a different thing altogether now. We look at disease. So this disease has to be treated in this fashion. So now we can have a protocol that if suppose you want to lose weight, which is about 10 kgs, 15 kgs, 25 kgs, or on and on. So we have a protocol on this. So Indian
Right.
government took out the first time in the history, the health ministry took out a paper on bariatric surgery and on whom the bariatric surgery can be done.
Mm-hmm.
So they have
I
a
think,
very very standardized, yes,
right.
protocol.
I
And
think
that only, yes, yes. So
Yeah, so that is what we are definitely shedding some light on those things that which we have to talk about and
yes,
uh, and deal with it. And basically, doctor, when we were talking about obesity and why we also happen to learn that why should we address obesity as a disease. So generally, there are certain myths and beliefs. We don't know whether our belief is a myth or a reality. So, what's
right.
the general myths and reality of obesity?
So obesity, yeah, generally means that uh, it's very easy. And I'm not saying about general public. I'm talking about even the doctors who were not really literate about the complexity of the obesity in recent times. So
Mm-hmm.
what you would do is that when you would go to a doctor with knee pain,
Yeah.
he would say, "Oh, go lose weight." So this is not practical because you can't. uh, the person can improve his nutrition, but you can't exercise with knee pain. So that was really not practical. So now, uh, so so solely what happened was that a few of us started reading about obesity, trying
Mm-hmm.
to treat it. So it all started in 2000 onwards, where India started to awaken that obesity is a problem, and with
Mm-hmm.
kids coming up being overweight and the fast food coming in, it was,
Overeating.
yes, overeating and stressful lifestyle, especially
Mm.
the computer engineers and all that. We have a lot of them sitting in front of computers, and you have the smartphones and all that. So a
Yeah.
lot of things changed. So that is where we started studying obesity, and then we started understanding that a lot of us actually didn't know about obesity, and we just would say that it is a lifestyle issue where people eat more, and just because it's because they just don't take care of themselves.
Yeah.
So it's much
So,
deeper than being just not not concerned about it. It's
mm,
much. It's a science in itself.
true, true. So, how to overcome obesity, doctor?
So there are a couple of things. One is the preventive aspect of it,
Mm-hmm.
and the other is of course the treatment aspect of it.
Mm-hmm.
So when you talk about the preventive aspect, that's the best thing to do. Don't gain weight at all. So being aware is extremely important. That every time you eat something, you look at it. That is it going to be nutritious, or just going to be bare calories which are going to increase weight for you?
Mm-hmm.
So calorie counting does work. So
Okay.
that's the best thing to do. Then secondly, of course, have a regular lifestyle. So if you have a regular sleep pattern, if you are exercising, not too much, but about moderate. So moderate means about 30 minutes a day. So in 24 hours, 30 minutes a day, 5 days a week is more than enough for you. So eat healthy, have adequate sleep, and good exercise. Maybe just going to office. Maybe just get down the bus one stop early and then walking up to your office. That's more than enough.
That's beautiful.
Yeah. So that's the preventive aspect of it. Now, if you
Mm-hmm.
want to treat it, so we treat it in different ways. So anyone who is incidentally, I would tell you that Indians as genes don't tolerate weight too much. So in
Mm-hmm.
West, the cutoff limit for obesity is 24 BMI. For Indians, it
Okay.
is 23 BMI. So by saying this, we would mean that beyond 23 BMI, Indians start to gain, show adverse signs and symptoms of obesity, which the Western population would show after 24 BMI or maybe after 32 BMI. So worldwide, the obesity is considered to be after 35 BMI. For Indians, it is 32.5 BMI. Not only Indians, we South population means including China, Japan, and other
Asian.
countries, the Asian population. So it's something to do with genes we really have not been able to understand. But we really know that after 32.5 BMI, it's a red flag.
Mm, right.
So, so that is the problem with the. So after so from 24, 23 BMI, 32.5 BMI. Um, so
Right.
so from this period, we can actually do some lifestyle changes and all that. But when it goes beyond 32.5 BMI, it becomes difficult. So then, when the other treatment choices are there, like the balloon placements, and
Mm-hmm.
then the pharmaceuticals, the medicine comes into picture, and then there is surgery, of course, where
Yeah.
we talk about bariatric surgery. It itself is a very big subject.
I think
So the target, yes, yes.
probably, if I'm not wrong, since a decade or little lesser than that, bariatric surgery is having its own place, where people are talking about it. They are contemplating probably. A few of them are not sure, but they have just heard the term bariatric. So, what is exactly bariatric surgery do, and how important or how necessary it is for obese people, doctor?
So one thing I may clarify here is that bariatric surgery is not for everyone.
Mm-hmm.
As a weight loss surgeon, I see a lot of people right from 24 BMI onwards to about 50, 60, 70 BMI who are um, who ask for bariatric surgery. Now, it's a typical example is where a girl who is about 26 BMI wants to get married in the next about 3 months and then wants to lose weight.
Okay.
So they would think that it is a quick fix to getting slim and then looking good and going up to uh, for the wedding. But that's not really the kind of people who qualify for bariatric surgery.
Okay.
So,
Yeah.
bariatric surgery per se is the surgery in which we actually do it laparoscopically. So there are no cuts involved. It's basically either through a robo or through laparoscopic surgery. We make keyholes and then we introduce a camera and do the whole procedure. So it's a
Mm-hmm.
complex procedure. What we do inside, we cut part of the stomach. We make the stomach smaller so that you eat less. Basically, it's a no rocket science there. But then we also do whatever you eat. Only part of it will be absorbed. So these two things work in tandem to reduce weight.
Mm-hmm.
So eat less, and whatever you eat is absorbed less. So this we achieve through making the stomach smaller and making a bypass inside the intestine so that the the weight loss whatever is target is achieved in about 1.5 years. So being such a complex surgery, we don't give it to everyone else. Only
Mm-hmm.
if you qualify, that means you should be above 32.5 BMI to qualify for for a surgery.
Mm-hmm.
Before that, we either maintain it through lifestyle changes, we advise them exercise, dietary consultations, and medications, including balloon placement in the stomach so that they feel full all the time. And that is where we look at about moderate weight loss, means we're looking about just 15 kgs or 16 kgs weight loss. Beyond that, it is difficult.
Right. Superb. And meanwhile, doctor, I'm sure you would have got many, many questions from your patients or probably outside wherever you go. What are the general questions when it comes to obesity that they would ask you? And by using this platform, would you like to answer those questions?
Oh yeah, there are there are huge amount of misconceptions about the surgery, the weight loss, and things like that. But I would probably focus on the surgical aspect of it because I'm a surgeon, and one thing I've already told you that that it's not for everyone.
Yeah.
So you need to go to a person who does these surgeries regularly, and then he would be able to tell you that no, this is not for you. These are the other options available to you, and this is so. That is one myth that we want to
Mm-hmm.
clarify. Mhm. The other myth is that the bariatric surgery is considered to be a plastic surgery
Uh-huh.
or something like a liposuction.
Yeah.
So, so what happened was that this question came up a lot about a couple of years ago when one of the I think Telugu actress succumbed to a surgery. Now that was purely a plastic surgery, uh, uh, a surgery which was basically liposuction,
Yeah.
but it was confused with bariatric surgery, weight loss surgery.
Mm-hmm. Mm-hmm.
So basically, the plastic surgery or the liposuction is sucking out of the fat which is already existent in some part of the body. Now, like suppose you just have a lot of fat in around the buttocks, or you have it around the thighs, or a few people have it around the tummy. So that what they do is they'll put in small suction devices and then they break it and then they'll suck it off. It's a quick fix. basically. So you
Yeah.
you end up probably they would end up sucking off about 5 to 6 kgs. You would go down and you would have a contour. So basically, it's a plastic surgery procedure. Bariatric surgery, what it really is not about how you look. It's about how you feel and it's all about the health. So overall health benefits, if you want to get, then the bariatric surgery is the one, and it is long lasting because
Mm-hmm.
we would guarantee that you would lose this amount of weight, and if you take care of yourself, you can probably for the next 10-20 years will not gain weight. While plastic surgery or liposuction would be one in which you would suck out the fat which is already existent, but you don't do anything which led you to this point. So you will automatically gain weight in next 6 months, 1 year time. So
Right.
this is what. So this is one of the big problems that we face when people want to lose weight and they want to have a quick fix. The other
That's a
thing is
valid.
that bariatric. Yes, yes. One of the and the other issue is that a lot of people who do yogas have
Mm-hmm.
been inspired by a few yoga gurus telling them that I lost 10 kgs in 5 days, lost 10 I went to this place and lost about 20 kgs in a month, which is not physically possible. Medical science cannot get you weight down for more than about 6 kgs per month. You
Mm-hmm.
physically cannot lose more than 6 kgs per month. So if you want to lose about 40 kgs, you will have to do so 6 kgs per month only you can lose. You can't do more
Mm-hmm.
than that. If you end up losing more, that means it's a body water that you have lost. It's not the fat, and the
Mm-hmm.
body water will come back.
Yeah.
So these
Okay.
are some of the most common things that we come across.
Mhm. Good things, good pointers to ponder on, in fact, and the valid points where all of us should be aware of. Thank you so much, Doctor. And at the end, while we wind up the conversation, would you like to give some health tips or something that all our viewers should keep in mind when it comes to their health and, the basically health?
Yep. So as a bariatric surgeon, I would like the Indian population, basically the Asian population, to read more about obesity and how it's affecting our health.
Mm-hmm.
Uh, so there is nothing called as fit obese people. If a lot of people would say that I am obese, but see I can dance. These people are really not healthy. You are looking at disease coming in the next 5 years or 10 years, whenever, but it's coming fast and it's going to come. So if there is nothing called as healthy obese, we should not look at uh, the obesity as just a lifestyle issue and I'm just happy, you know. So we try to get the right weight. Then the other thing is that on the other extreme, we don't want to stigmatize this. So the healthy weight, uh, the health is not related to weight completely. So we would not say that if I'm skinny, I am healthy.
Yeah.
So the whole process should not be to only look skinny or thin. That is again not healthy. So you have to have a healthy weight on you.
Mm.
So the most important thing is to keep a moderation there. The other thing important is that about 150 minutes of exercise per week is more than enough to get you into shape.
Mm-hmm. Mm-hmm.
Look at what you eat.
Yeah.
Avoid processed food. Processed food comes with a lot of problems. It's cheap, but it comes at a cost. Sweets, sugar, especially sodas. So we have years of data now that sodas have huge amount of sugars. What it would do is get you weight and then shock your system into insulin high, and then you will cause insulin resistance. So what will happen is that they become diabetic. They also will gain weight, they'll become diabetic and hypertensive. So we have kids who are 26, 27 years of age sitting in front of computers, having sodas after sodas, ordering from the providers. And then these are the people who are going to be extremely sick. So
Right.
what's going to happen is that this is going to translate into a healthcare emergency, because there are going to be a lot of stress on the healthcare system in times to come. So
Mm-hmm.
57% of the population, if it's not healthy,
Yes.
is just a stress on the healthcare system of the country. So
Yeah.
if you have to do that, just look at what you eat. The sleep is extremely important. People would say that, oh, 6 hours is more than enough for me. No, it's affecting you. So 6 hours you sleep, then what happens to your hormone levels, you will not know. Eventually, they will gain weight. So so these are things in your hand. I can't talk about stress because work related stress will be there. But look after yourself, guys. Um, it's not good to consult a bariatric surgeon when it's you are already about 32.5 BMI. Keep your weight healthy. Keep look at just most important, see what you eat.
Beautiful. Thank you so much for wonderful information. And these are the things where each one of us should keep in mind. And that's really sweet of you for giving us all the details for all our viewers here. And thank you so much, Doctor.
Thank you, Nikita. It was wonderful
Yes.
talking to you.
Same here, and thank you. So that was Dr. Saurabh Misra, consultant and head of Gastro-intestinal, Robotic and Bariatric Surgeon Apollo Hospitals, Bangalore, and signing off, RJ Nikitha from Radio City 91.1 Bangalore. Thank you. Thank you so
Namaskar.
much, Doc. Yes,
Bye.
namaskara.